Against illegal and oftentimes deadly drugs continues every day. And recently, some new sanctions went into place that the president's office says could make a difference in controlling what makes it across the borders. This afternoon, we have Dr. Gupta with us. He is the director of President Biden's Office of National Drug Control Policy and is here to talk a little bit more about the ongoing issue here and across this country. Dr. Gupta, thanks for taking some time to talk with us this afternoon.
Thank you for having me, Kelly. Appreciate it.
So first, there are some new sanctions that Treasury Secretary Yellen announced related to drug trafficking. Can you tell us a little bit more information about that?
Certainly. From day one, it's been really a top priority for President Biden to make sure we're doing everything possible to defeat the opioid epidemic and save American lives. Part of that's been going after the drug traffickers and producers in every way possible. And therefore, today, not only is Secretary Yellen traveling to Mexico City, but also we have announced actions against 15 individuals and 2 entities that are affiliated with this terrible Mexican drug cartel called BLO, or Beltran Leyva organization, who are involved in both the production and trafficking of fentanyl across the border.
What kind of impact do sanctions like these have on drug trafficking and drugs just in our country?
Well, what we have learned over the years is that these organizations function because they make money off the vulnerabilities of Americans. And this is exactly what we're doing now, is to break that money cycle, the global supply chain. The president has been very clear that this is a global threat, and we need to address it as such. So what these sanctions do is to take away their ability to seamlessly work across systems and actually prey on Americans. We deny them the money, which is a lifeblood of their operations, both from a profit standpoint as well as from operating capital standpoint.
It seems like now anything we hear about drugs, it's either fentanyl or it's laced with fentanyl. Can you talk a little bit about its potency and how deadly it really is?
Yeah, I think we need to be careful and aware that over the last several years now, fentanyl, which is 50 to 100 times more potent than morphine, is become primarily a drug that is killing Americans. And oftentimes, Americans aren't aware. For example, oftentimes people would order online drugs like what they think is Xanax or Adderall. And what happens is they get counterfeit pills in terms of having potentially fatal doses of fentanyl in them. It is this type of information that's important for people to know, that if you need help, whether it's anxiety, pain, or other things, seek help from a legitimate provider. Do not order drugs online. And then carry with you naloxone, or the antidote for fentanyl, which could not only save your life, but someone else's life in case they were unknowingly poisoned.
We've done a lot of stories about having naloxone here in Ohio. Are you able to talk about fentanyl and what's being seen in the Midwest, or Ohio specifically?
Yeah, so we know that in Ohio and a number of states, we see fentanyl as the primary killer or primary culprit. That's why we do have an antidote in naloxone, as you mentioned, Kaylee. It is very important that whether it's schools, malls, individual businesses, to have naloxone. I have naloxone in our office on a wall right next to a defibrillator or a fire extinguisher. This is how important it is, because it can also save someone's life. Now, today, naloxone products are available over the counter, sitting right next to Motrin and Tylenol. And the fact is that they're easily accessible, but also affordable, available at almost no cost to people if they want to go to the pharmacy and get it.
Dr. Gupta, I only have a few more seconds. I really quickly want to hit on stories about babies and kids dying from or being, overdosed from being exposed to fentanyl. Is this unusual, and are you all keeping an eye on it?
Well, we're certainly monitoring it. We're monitoring it, not only the exposure to fentanyl, but also the in utero exposure to drugs like fentanyl. So it's critical, that when we look at the drugs, we understand that especially babies, but younger people may be more vulnerable than adults just because of their surface area of the body. It is really important because, as a physician, I could tell you the most important piece is that we protect our children from the scourge of deadly drugs like fentanyl. So it's really, really critical that we ensure that young people, especially babies, are protected and stay away from any exposure to any drugs that includes fentanyl.
Dr. Gupta, very important information today. Thanks again so much for joining us.